The question before this chamber is straightforward on this resolution. Approve it and realize more than $1.5 billion in savings over the biennium. Make deep structural changes to our workforce that leads to more than $24 billion in savings over the next 20 years, all while reaffirming the value and dignity of the work done by thousands of middle-class state workers. Or reject it and reject those savings, deepen the state's fiscal crisis, and repudiate more than 4 decades of collective bargaining in the state of Connecticut. Mr. Speaker, the savings and concessions in the agreement that is the subject of this resolution are significant and substantial. In the short term, over the biennium, $700 million in total savings in fiscal year 18, $868.6 million in savings in fiscal year 19, and that's composed of various components, including wage savings, zeros in fiscal year 17, 18, and 19, as well as 3 furlough days. Now, let me just spend a second on the wage savings, because I'm aware that everybody's got the OFA report, and OFA booked 0 in wage savings for fiscal years 18 and 19. The fact is, Mr. Speaker, that every budget, Republican House budget, Republican Senate budget, governor's proposed budget, our proposed budgets, they all book more than $300 million in wage savings for fiscal year 18 and 19 based on 0% increases. Zeros in step, zeros in wages. That is real savings. That means we do not have to account for any wage enhancements in fiscal year 18 or 19 as part of the biennium. Pension savings, $210 million in the first year, $238 million in the second year, achieved via increases in employee contributions, decreases in state contributions, cost of living restructuring, and other changes. That's massively significant, and those pension changes are also built off of those zeros. The actuaries that looked at this, a month ago that report came out, the actuaries that looked at this have booked those savings based on those zeros in the out years, starting with $200 million, $300 million, it drives up to $400 to $500 million in savings in pension actuarial contributions over the long term. That is significant. Healthcare savings, $154 million in the first year, $261 million in the second year, achieved via various measures, increases in drug copays, structural plan design changes, premium cost share increases. You wanted structural change? This is structural change. And it gets better. Long term, $5 billion in combined savings over 5 years, $24 billion over 20 years, and we pay off the unfunded pension liability in 30 years. A new class of employees added for anybody hired after 7/1/17. And they will participate not only in a defined benefit plan, but for the first time ever, a defined contribution plan. Increases in employee pension contributions, both in amount and over time. From 10 years to 15 years now you have to buy in. We move retirees to a Medicaid Advantage plan, starting 1/1/18, for $200 million in savings in the biennium and more savings in the out years. Let me pause on the Medicaid Advantage plan for a second, because I've heard a number of proposals out there that say we can just do this as a technical matter. We can just move them over. We don't need any agreement to do that. Or we can impose it unilaterally on our retirees. No, we can't. As everybody knows, that SEBAC agreement that's currently in effect expires in 2022. I would submit to you that any change that accounts for $200 million in the first 2 years is a substantial change. And when you make a substantial change to a contract, when the state unilaterally makes a substantial change to a contract, rather than bargaining for it, it is subject to suit under Article 1, Section 10, the Contracts Clause of the United States Constitution. So we cannot make that change unilaterally or we'll wind up in court. But we can collectively bargain for that change, and that's what this resolution does, what the agreement underlying it does. In addition, structural change, we smooth out pension payments, resulting, as I mentioned, in $300 to $400 million in reduced actuarially required pension contributions in the first 10 to 15 years, and that increases to $400 to $500 million in the out years, and again, we pay off that unfunded liability. Not included in any actuarial report or OFA's report is that zero for fiscal year 17. We owe nothing for that last year. All those bargaining unit contracts expired at 3%. Everybody's contract had RSAs, reserve for salary adjustments, based on that 3. We do not owe that. 0 for 17, 0 for 18, 0 for 19. Not included in there, not included in any actuarial report, is about $25 million in savings of moving people to SSDI, Social Security Disability Insurance. That's another massive concession and a structural change. So what do we get for all this? Or what do we have to give up, for all this? Because this is a collectively bargained for agreement. Well, there's no layoffs for 4 years to 6/30/2021. Now, I've heard a number of people say, no layoffs, our hands are tied for 10 years. That's not true. Again, those wage and hour agreements expire at 6/30/21. Yes, there's no layoffs, but no layoffs does not mean no reduction in state workforce. That no layoff language that's in this agreement is the same exact language we've had in prior SEBAC agreements, most recently 2011 to 2015. And in the last 10 years, the unionized state workforce has shrunk by 15%. We can still do reorganizations, and this is important, anyone hired after 7/1/17 this year is not subject to that. They do not get the layoff protection. So you can do reorganizations, you can do layoffs of new workers, and no layoffs does not mean no reduction in state workforce. Mr. Speaker, you assess a deal by whether or not it increases a liability or decreases it. Either it saves money or it doesn't. This deal saves billions. Now again, the choice is to approve this resolution or reject it. Understand, if you reject this agreement, this collectively bargained for agreement, it produces immediate savings. It's the only way to get those immediate savings for the biennium. Because if you reject this deal, you're likely in arbitration and you don't get all the structural changes on the pension and healthcare side. And again, as I mentioned with Medicare Advantage, I want to be clear here, you cannot make those structural changes unilaterally, or we are sued under the contracts clause and we lose. And everybody's familiar with the Rowland suit, and we're paying for that. At its heart, I think the choice here that I've heard between this agreement and accepting this agreement and rejecting it is really a choice about collective bargaining, whether we're going to continue to have that in the state of Connecticut. And I just want to close by saying that choice isn't just financial. It's not just numbers on a page. Our state workers live here, they raise their families here, they pay taxes here, they spend their money here. They protect us, they build our roads, they maintain our parks, they drive our buses, they care for our elderly, our infirm, and are disabled. They built the middle class in this state. They were part of that. They are the middle class in this state. And by this agreement, they are helping preserve the middle class in this state. They've done their job for decades. It's time for us to do the same. Thank you, Mr. Speaker.